Hi, my name is Musa bin Rizam. Today I'm going to present about pulmonary stenosis. So for the introduction, pulmonary stenosis is a congenital heart defect characterized by narrowing of the pulmonary valve, which regulate blood flow from the right ventricle to the pulmonary artery and lung. This narrow valve obstruct blood flow, causing the right ventricle to work harder to pump blood to the lung. And the severity ranges from mild to severe and may lead to RVH, right ventricle hypertrophy, if left untreated. Why it can cause RVH? Because the right ventricle needs to pump harder than normal one. So next we are going to go to etiology and risk factor. So for the causes, congenital malformation of the pulmonary valve, it most common causes for PS, and abnormal development of valve leaflet during fetal growth. So uh, it occurs during fetal heart development before birth. The pulmonary valve leaflet become thickened, fused, or dysplastic. As a result, the valve opening becomes smaller than normal and restrict the blood flow from the right ventricle to the pulmonary artery. And next is a genetic syndrome, particularly associated with Noonan syndrome. Individuals with Noonan syndrome commonly have abnormal pulmonary valve development. Why? Because the genetic mutation affect normal heart valve formation during embryonic development. And next is a rarely acquired later in life due to rheumatic fever. Rheumatic fever, inflammatory disease that develop after untreated streptococcal throat infection, and it can cause scarring and thickening of heart valve. Why? Because chronic inflammation damage valve tissue, making the valve stiff and narrow. And the last one for the causes is carcinoid syndrome. Neuro neuro neuroendocrine tumor release substance such as serotonin into the bloodstream. And why? It because this substance cause fibrosis, scar tissue formation on heart valve leading to valve narrowing. So next is the risk factor. The first one is maternal rubella, German measles infection during pregnancy. Why it can cause PS? The virus affect the formation of cardiac structure, including the pulmonary valve. And the next one is genetic syndrome, especially Noonan syndrome. Uh, like I explained before, it can cause disrupt normal valve formation during fetal growth. And then family history of congenital heart disease, because certain genes involved in heart development may be inherited. And the next one is rheumatic fever. And the last one is a carcinoid syndrome affecting heart valve. So next we are going to go to sign and symptom. Why heart murmur is a symptom for pulmonary stenosis? Because the blood becomes turbulent as it passes through the narrow pulmonary valve. This turbulence creates the characteristic systolic murmur heard during auscultation. So the next sign and symptom is SOB, especially during physical activity. Less blood reaches the lung for oxygenation, and the body receives less oxygen during physical activity, causing breathlessness, or we call SOB. So fatigue or reduced exercise tolerance can reduce blood flow to the lung, decrease oxygen delivery to the tissue, and the muscle receive uh, less oxygen, leading to tiredness and reduced endurance. So for chest pain, why? The right ventricle works harder and require more oxygen, and it increase workload and causes myocardial strain and chest discomfort. So this and the next sign and symptom is dizziness. In severe PS may reduce cardiac output and less blood reach to the brain, especially during exertion, causing dizziness or fainting. So the next one is cyanosis. Why cyanosis is a symptom for patient who have PS? In severe case, oxygen level in the bloodstream becomes low, and poor oxygenation causes a bluish discoloration of the skin, leaves, and nail beds. So next, for sign and symptom in infant, poor feeding. Why? Because feeding requires significant energy, and infants becomes tired quickly because of reduced oxygen delivery. And the next one is rapid breathing, or we call tachypnea. The body attempts to compensate for reduced oxygen delivery by increasing respiratory rate. And the last one is failure to thrive. Why failure to thrive is a symptom for PS? It because it increase energy ex- expenditure, and inadequate feeding lead to poor weight gain and growth. So that's all from me. I hope you can understand what I present about pulmonary stenosis.
Anatomy and pathophysiology. Pulmonary stenosis is a congenital heart disease characterized by an obstruction to blood flow from the right ventricle to the pulmonary artery. Based on the location of obstruction, pulmonary stenosis can be classified into three types. First, subvalvular or infundibular stenosis. Obstruction occurs in the right ventricular outflow tract below the pulmonary valve. Second, valvular stenosis. Obstruction occurs at the pulmonary valve and is the most common type. Third, supravalvular stenosis. Obstruction occurs above the pulmonary valve within the pulmonary artery. Pulmonary stenosis is commonly associated with congenital conditions such as tetralogy of Fallot, Noonan syndrome, and carcinoid syndrome. The obstruction increases resistance to blood flow, causing right ventricular pressure overload. Over time, this leads to right ventricular hypertrophy followed by a right ventricular diastolic dysfunction, and eventually right heart failure if left untreated. For the echocardiographic findings, 2D echocardiographic features, the main findings include right ventricular hypertrophy, which may be concentric or eccentric, right atrial enlargement due to increased right-sided pressures, thickening of the pulmonary valve leaflets, doming, dysplastic, and narrowing. The views that can be used is apical four chamber and parasternal-shock-axis AOPA level. For the Doppler findings, Doppler echograph, color Doppler. Color Doppler demonstrates turbulent flow across the stenotic valve. Second, continuous wave Doppler. Continuous wave Doppler is used to measure the highest velocity across the obstruction. The pressure gradient is calculated using the modified Bernoulli equation. And lastly, pulse wave Doppler. Pulse wave Doppler helps identify the exact location of the obstruction within the right ventricular outflow tract or pulmonary valve. For the severity assessment, the severity of pulmonary stenosis is classified based on peak velocity and peak pressure gradient. Next is example 1. For the first case, the echocardiographic image demonstrates doming of the pulmonary valve leaflets, a hyperechoic obstructive membrane located at the mid-right ventricular region. Turbulent flow on color Doppler. Next, the continuous wave Doppler before intervention showed a peak pressure gradient of 190 mmHg, indicating critical pulmonary stenosis. Following treatment, the peak pressure gradient decreased to 65 mmHg, demonstrating significant improvement in the severity of obstruction. Example 2, in the second case, the first image demonstrates commissural fusion of the pulmonary valve with systolic damping. The second image shows mild pulmonary regurgitation. Continuous wave Doppler revealed a mean pressure gradient of 80 mmHg. Since this value exceeds the severe threshold, the patient is classified as having severe pulmonary stenosis.
Good evening, sir. My name is Michelle Sarampagat, and I will be presenting the final part of our topic, which include differential diagnosis, clinical significance and complication, management, and conclusion. So first, let's discuss the differential diagnosis of pulmonary stenosis. Several conditions may present with similar clinical finding and should be considered during diagnosis. These include double chamber right ventricle, absent pulmonary valve syndrome, tetralogy of Fallot, and pulmonary atresia with intact ventricular septum. So patients with this condition may exhibit similar signs and symptoms such as a heart murmur, cyanosis, or bluish discoloration of the skin, exercise intolerance, SOB, and right ventricular hypertrophy. Therefore, echocardiography is important in differentiating these conditions and establishing the correct diagnosis. Next, I will discuss the clinical significance and complication of pulmonary stenosis. Pulmonary stenosis causes obstruction of blood flow from the right ventricle to the pulmonary artery. As a result, the right ventricle must generate higher pressure to pump blood through the narrow valve. Over time, this increased workload leads to right ventricular hypertrophy, which is the thickening of the right ventricular muscle. A severe stenosis may also reduce blood flow to the lungs and decrease oxygen delivery to the body. If left untreated, pulmonary stenosis can result in several complications. These include right side heart failure, cardiac arrhythmias, exercise intolerance, fatigue, chest pain, syncope, or fainting episode, and stenosis in severe cases. Therefore, early diagnosis and appropriate treatment are important to prevent disease progression and improve the patient outcome. Now let's move on to the management and treatment. For patients with mild pulmonary stenosis, treatment is usually not required. These patients are monitored through regular follow-up appointments and periodic echocardiography assessment to evaluate disease progression. For moderate to severe PS, the preferred treatment is balloon pulmonary valvuloplasty. This minimally invasive procedure is considered the first-line treatment because it effectively relieves valve obstruction and improves blood flow. In severe or complex cases where balloon valvuloplasty is not suitable, so surgical intervention may be necessary. Surgical options include pulmonary valvotomy or pulmonary valve replacement. So after treatment, patient require regular follow-up and echocardiographic assessment to monitor valve function, detect restenosis, and evaluate right ventricle function. So in conclusion, the pulmonary stenosis is a condition characterized by obstruction of blood flow from the right ventricle to the pulmonary artery. The severity can range from mild to severe, and echocardiography play a crucial role in diagnosis, assessment, and follow-up. With timely intervention and appropriate management, patient outcome can be significantly improved. Thank you.